I'm David Landry. I'm the CEO of Spectrum Medical Group and very happy to announce our 20th anniversary as a company. Spectrum formed in 1996. It was the result of a merger of five medical practices. There were two anesthesiology groups, two radiology groups, and a pathology group that formed Spectrum. And at the time, the idea was to create a physician-owned and oriented medical organization that could help influence healthcare policy, healthcare delivery, and ensure that the physician's voice was at the center of that, with their emphasis on patient care and how the physicians wanted to provide medical services and healthcare to patients of the state of Maine. So when Spectrum formed, there were approximately 65 doctors, and they were primarily centered around Maine Medical Center in Portland and Eastern Maine Medical Center in Bangor. And from there was an early interest in expanding into other communities. The thought was that if we could deliver healthcare on a regional basis and evolve medical practice from what was traditionally a very generalist type of model, and as medicine became much more complex and subspecialized, we were hoping to bring subspecialty medical care out into the communities of Maine. So part of our growth was in parallel to hospital consolidation that occurred here in Maine. Spectrum grew from a small medical practice to one of the larger healthcare organizations in the state. We then began providing services in New Hampshire and northern Massachusetts. Many hospitals and other healthcare providers came to us because we could deliver the care at a lower cost. We were able to invest in quality and other performance improvement programs that smaller organizations couldn't. And we started to develop a reputation, first geographically here in the Northeast, and then over time a national reputation, especially as it related to some of our quality improvement programs. So by 2005, Spectrum was up to almost 200 physicians. We had over 200 employees. We provided services in all 16 counties of Maine, as well as parts of New Hampshire and Massachusetts. We touched over 300,000 Maine citizens and another 40 to 50,000 citizens from northern New England. In the mid-2000s, we started to expand beyond those initial specialties. And some of the milestones there included the creation of an independent practice association around 2010, and that was a collection of 11 medical practices, all with a similar vision of physician-oriented and directed healthcare. From there, Spectrum began providing services in orthopedics, first with the merger of Orthopedic Associates into Spectrum in 2014, and then subsequently with the merger of Central Maine Orthopedics into Spectrum in 2016. We are now the largest non-hospital provider of healthcare services in northern New England. And we provide that across 20 different subspecialty practice areas. When I think about the ethics that our physicians have, it really is something that I'm proud of. So that's at the highest level. Having worked with physicians and medical groups and health systems my entire professional career, I think what we have here at Spectrum is somewhat unique. That people come to work because we're doing good things by our patients. It's a lot of motivation, and that's infectious. And we have almost a 20-year history of essentially taking revenue off the top and using that to invest back in our communities. We provide over $10 million in free care to patients that can't afford their medical services. So, those, again, it speaks to the leadership and dedication of the physicians that they're here to support not only our patients, but the communities that we live in. Some of the other things that we've done that, I'm proud of, we are a sponsor of a medical student through the Tufts program. We have an endowed scholarship, and so Every 4 years we sponsor a new student that help underwrite the cost of education with the idea that this is the next generation of physicians, and we want to train them here in Maine, and we want them to stay here in Maine. And then finally, the tenure of our physicians and employees is one that I think speaks to Spectrum being a really wonderful place to work. Most of our physicians come here starting their career and ending their career as Spectrum physicians. We do not have a lot of turnover amongst our physicians. They don't tend to leave the practice to go elsewhere. And similarly with our employees. We have scores of employees that have 15, 20, 25, 30 years of service. Working for Spectrum or working for organizations that predated Spectrum and then coming into the family. So that type of tenure you don't really see that often in this day and age. The career job is something that was a generation ago. So I'm proud that our work environment is such that both the physicians and the employees really want to be here. Dr. Chris Pope was the original president of Spectrum, a radiologist. He and Dr. Catherine Pope, who was an anesthesiologist and was head of the largest anesthesiology group in Maine, had the initial vision about putting this together. They were joined by colleagues John Long and Michael Pankow, the radiologist from the Bangor community, John Franklin, an anesthesiologist from the Bangor community, and Michael Jones, a pathologist in Portland. And those physicians and others were the core leaders that spent countless hours contemplating what would a organization look like, why would it be different, what could we do together that could create more synergy than being apart. They spent a lot of time educating their physician colleagues about this. Again, pretty novel to have those different specialties come together, especially at that point in time. And then they spent a lot of time educating others, healthcare systems, hospitals, insurance companies, government regulators, as to why this was good for Maine. And so, as with most great organizations, they had the vision, they founded it. The work that's been done since then has been other people standing on their shoulders to improve the organization. And that's why I imagine for the future. We're at a place now with nearly 700 employees, providing over 1 million healthcare services a year. The next generation of physician and non-physician leaders of Spectrum will stand on our shoulders and take this to the next level over the next 20 years. And while all change can be anxiety-provoking and even scary, we are one of only a handful of organizations that are on the vanguard of this change. So the things that we are doing in healthcare generally, and the things that Spectrum are doing, I think 5, 10, 15 years from now, people will look back and say, this is when healthcare revolutionized itself. The industry evolved so that we will be looking at a better healthcare delivery system in 5 or 10 years from now than what we have today, which obviously is the best system in the world. So we're improving upon that. I think that's really exciting that we're in a position where we can not only influence that, but lead that. We have numbers of physicians involved in the clinical transformation. We have numbers of administrative and executive personnel involved in the healthcare delivery and finance transformation that's occurring. And Spectrum is in a good position because most of the other players are hospital or insurance company organizations, and we're one of the few physician-led organizations that is really providing leadership in the transformation of healthcare. I'd like to acknowledge several individuals and organizations that have been instrumental in Spectrum's growth and success. First and foremost, our employees. All of our employees that have supported the practice, the physicians themselves that have invested the time, not only in their clinical practice, but in the business. We wouldn't be there without those countless hours of work. We've had some real strong business partners in healthcare, Eastern Maine Healthcare, Maine Health, are two that are strong partners to Spectrum.
So the relationships that we've been able to forge that have crossed many boundaries, particularly the health system boundaries. We have several large health systems within the state, and I believe that those systems understand the value of having a statewide entity that can bring differing views and delivery of care, standardized delivery of care in particular, to the various hospitals and patients throughout the state.